Montero. I'm the youth liaison here in the White House Office of Public Engagement, the front door to the White House and agencies across government. Thank you for taking the time to join today's call on an issue of critical importance, ensuring that we have quality health insurance that's dependable and affordable. You may remember that yesterday the President actually called this one of the defining struggles of our generation. We have some knowledgeable folks that are on the line and about to present to you. Ms. Buffy Wicks, Deputy Director for the White House Office of Public Engagement, Mina Shamani, Director of Policy Analysis at the Department of Health and Human Services, and Mr. David Seamus, the Senior Advisor to David Axelrod and Director of White House Communications. Just a quick note from some of the lawyers here at the White House. Please note this call is not for press purposes and is for background only. Now that we have that out of the way, I want to be sure that you have the address for our office with any follow-up questions or comments. It's public@who.eop.gov. Public, as in the word public, at WHO, as in White House Office, .eop, Executive Office of the President, .gov. Between my personal email and this address, we want to be sure that we keep in touch beyond today. So again, our first speaker is Ms. Buffy Wicks, Deputy Director for the White House Office of Public Engagement. Buffy, the floor is yours.
Thanks, Paul, and thank you, everyone, for getting on the call today. As Paul mentioned, my name is Buffy Wicks. I'm here at the Office of Public Engagement here at the White House. We appreciate you getting on this call. We do many of these types of calls really in an effort to get you the most up-to-date information from the administration. As Paul mentioned earlier, and as most of you know, the President gave a very rousing speech yesterday at the University of Maryland at College Park. Also yesterday, the Department of Health and Human Services released a new report on the struggles that young adults face in the current healthcare system. This report demonstrates how health insurance reform is so vital for young folks. And in a moment, Dr. Shamani is going to be on from HHS to discuss this report. As the President mentioned in his speech, 1 in 3 young adults don't have health insurance and live one accident or illness away from bankruptcy. And nearly half of young adults have trouble paying for medical bills, and nearly 40% are in debt because of them. The President took this opportunity to directly address young adults because he knows that we need real change and that young people are truly the catalyst for that change. As you listen to this call and you listen to the information that you're about to hear, I want you to really think about this and think that this is really about you, and it's really about your future. We know that you feel the effects of the lack of stability, security, and affordability that pervades our healthcare system. And we know that the more that you know about this issue and the more that you are engaged on this issue, the more that you participate in this national debate, the closer that we get to real change. Every movement for change has been led by young people in this country. Young people have their shoulder to the wheel of history, and now is when we need your participation the most. So I just wanted to thank you for getting on this call. We're going to be emailing you out a reform guide called Young Adults for Health Insurance Reform, and we want you to really take a look at that, and we want you to really get engaged. Now I'm going to turn it over to Dr. Shamani from the Department of Health and Human Services to give you some more detailed information on this.
Thanks, Buffy. Hi, everyone. So again, my name is Mina Shamani. I work as the Director of Policy Analysis in the Office of Health Reform at Health and Human Services. One of the things among many that we do in that office is provide information through reports to be able to educate people about the current status of the healthcare system and about how health insurance reform will help them. And most recently, we have put together a report demonstrating the need for health insurance reform for young Americans. And this was in conjunction, as Buffy mentioned, with the President's rally at the University of Maryland yesterday. So very briefly, I'll just go through and give some highlights from the report. And I'll note that, if you want to read further and certainly pass it along, they can be found at healthreform.gov under the reports section. So basically, the report goes through the struggles that young adults face in the current healthcare system and then demonstrates why health insurance reform is so vital for young adults. First, talking about a pervasive lack of coverage. As Buffy mentioned, about a third of young adults don't have any health insurance, and they have the highest uninsurance rate of any age cohort. And in part, this is because the employer-based insurance system doesn't work for them. Young adults are more likely to be part-time workers, they're more likely to work in small businesses, and they're just starting out their careers, so they're more likely to change jobs, move, all things that make employer-based coverage difficult to obtain and difficult to keep. For instance, even among young adults who have employer-based coverage now, in 2 years, one